Assalamualaikum, dear audience. I welcome all in today's 29th lecture on pathology. Today, day 1 of shock. Before going to discuss about shock, we want to recapitulate. Suppose this is heart. From the heart, blood comes out, and this oxygenated blood supplies throughout the body. Lateral, the blood again comes to the right atrium, then in the right ventricle, then it goes to the lungs. When it is purified, again comes in the heart. This is the cardiovascular system, and this is the circulation of blood. Dear audience, if heart and blood vessels, that is cardiovascular system, if the cardiovascular system is defective, what will happen? There will be disturbances in the carrying of blood through the tissue properly. Again, if cardiovascular system is normally functioning, but blood volume is decreased. First one, if cardiovascular system is defective, blood volume is normal, or if the cardiovascular system is normal functioning but blood volume is decreased, what will happen? There will be hypoperfusion of the tissue. Again, suppose this is the heart, it pumps, blood comes out. Again, after circulation throughout the body, blood goes to the heart, then to lung, again comes to heart. And if there is defect in the cardiovascular system, but normal blood volume, or if cardiovascular system is normally functioning but blood volume is decreased, then there will be hypoperfusion throughout the body. And if this hypoperfusion threatens life, this is called shock. Now come to what is shock. Despite systemic widespread hypoperfusion of tissue due to disparity between cardiovascular system and blood volume, that may threaten life is called shock. Nowadays, systemic widespread hypoperfusion of tissue due to disparity between cardiovascular system and blood volume, that may threaten life is called shock. Again, if there is disparity between this cardiovascular system and the blood volume, and this disparity may be due to defect in the cardiovascular system or due to decreased blood volume. And if this disparity threatens life, this is called shock. Again, systemic widespread hyperperfusion of tissue due to disparity between cardiovascular system and blood volume that may threaten life is called shock. Now come to classification of shock. Hypovolumic shock, hypovolumic shock means shock due to hypovolumia, shock due to decreased blood volume. What are the causes of hypovolumia? Causes of hypovolumia: blood loss, that is acute blood loss, diarrhea, excessive vomiting, extensive burn, extensive trauma. These are the different causes of hypovolumia, that is, these are the causes of decreased blood volume. Cardiogenic shock, shock due to disease of heart, cardiogenic shock. What are the diseases of heart that will lead to shock? The common disease is myocardial infarction, endocarditis, ventricular arrhythmia. So these are the different causes of cardiogenic shock. Neurogenic shock, as in spinal cord injury, anesthetic accidents, anaphylactic shock, septic shock. So these are the different types of shock: hypovolumic shock, cardiogenic shock, neurogenic shock, anaphylactic shock, septic shock. Dear audience, again we want to recapitulate. Shock is the systemic widespread hypoperfusion of tissue due to disparity between cardiovascular system and blood volume that may threaten life is called shock. First come to hypovolumic shock. Dear audience, in shock, the end result of shock is the hypotension. End result of shock is hypotension. End result of shock is hypotension. And in shock, there is decreased effective circulating blood volume. What happens in shock? there is hypotension and there is decreased effective circulating blood volume. Decreased effective circulating blood volume. So, end result of shock is hypotension, and in shock there is decreased effective circulating blood volume. What happens in hypovolumic shock? That is mechanism of hypovolumic shock. Hypovolumia, that is decreased blood volume. That is decreased blood volume. If there is decreased blood volume, what will happen? There will be decreased cardiac output. Decreased cardiac output. If there is decreased cardiac output, what will happen? There will be decreased effective circulating blood volume. Decreased effective circulating blood volume. As there is decreased effective circulating blood volume, there will be widespread systemic hypoperfusion. Widespread hypoperfusion. And ultimately there is shock. So this is the mechanism of hypovolumic shock. Now come to cardiogenic shock. Audience, I have told you the common cause of cardiogenic shock is myocardial infarction. Myocardial infarction, audience, to know localized area of ischemic necrosis either due to sudden arterial occlusion or impaired venous return is called infarct, and the phenomenon is called infarction. If coronary artery blockage, there will be ischemic necrosis of the myocardium, and this is called myocardial infarction. So if suppose this is heart, and if there is myocardial infarction, what will happen? If there is myocardial infarction, the heart become weak and heart cannot pump properly. As the heart cannot pump properly, there will be decreased cardiac output. Decreased cardiac output. As there is decreased cardiac output, there will be decreased effective circulating blood volume. Decreased effective circulating blood volume. As there is decreased circulating effective circulating blood volume, there will be hypoperfusion of tissue, widespread hypoperfusion, and that will lead to shock. So this is the mechanism of cardiogenic shock. Now come to anaphylactic shock. It is immunoglobulin E mediated hypersensitivity reaction. It is IgE mediated hypersensitivity reaction. What happens here? One is systemic vasodilatation, another is increased vascular permeability. Nowadays, in IgE mediated hypersensitivity reaction, there occurs systemic vasodilatation and increased vascular permeability. How this systemic vasodilatation and increased vascular permeability may lead to shock? Now come to that point. Systemic vasodilation, what will happen? There will be dilatation of the vessels. So there is a pooling of blood. As pooling of blood following vasodilatation, there will be decreased cardiac output. Cardiac output is decreased. As decreased cardiac output, there will be decreased effective circulating blood volume. There will be decreased effective circulating blood volume. Again, come to increased vascular permeability. Dear audience, suppose this is the blood vessel, the endothelial lining. If increased vascular permeability, what will happen? Increased vascular permeability, there will be reduction of blood volume. As reduction of blood volume, there will be decreased cardiac output. As decreased cardiac output, there will be decreased effective circulating blood volume. Decreased effective circulating blood volume. Dear audience, you see it is IgE mediated hypersensitivity reaction. There is systemic vasodilatation that leads to decreased effective circulating blood volume. There is increased vascular permeability that leads to ultimately decreased effective circulating blood volume. As there is decreased effective circulating blood volume, there will be widespread hypoperfusion. And there will be shock. So this is the mechanism of shock in anaphylactic shock, that is IgE mediated hypersensitivity reaction. Now come to neurogenic shock, mechanism of neurogenic shock. Dear audience, you know, if this is the blood vessel and this is the lining in the thallium, this is the blood vessel 1. In normal anatomical and physiological condition, there is vascular tone, partial state of contraction. That is, there is vascular tone. If there is neurogenic shock, what will happen? In neurogenic shock, vascular tone is decreased. As vascular tone is decreased in neurogenic shock, what will happen? There will be relaxation of blood vessels. Relaxation of blood vessels. As there is relaxation of blood vessels, there will be pooling of blood in the blood vessel. Pooling of blood. As pooling of blood, there will be decreased cardiac output. As there is decreased cardiac output, there will be decreased effective circulating blood volume. Decreased circulating, decreased effective circulating blood volume. So, vascular tone is decreased, relaxation of blood vessel, pooling of blood, decreased cardiac output, and it will lead to decreased effective circulating blood volume. There will be hypoperfusion, shock. Dear audience, now come to stages of shock. Now come to stages of shock. There are 3 stages of shock. One is early compensated state. One is early compensated stage, progressive decompensated stage, and third one is irreversible stage of shock. So one is early compensated stage, progressive decompensated stage, and irreversible stage of shock. Now come to first early compensated stage. Dear audience, suppose 15% blood is lost. If 15% blood is lost, there is definitely hypovolemia. There is reduction of blood volume. In this stage, what happens to compensate this loss of blood and to recover from the shock? This is the early compensated stage. What happens? The mechanism. First, there is vasoconstriction. Vasoconstriction. Then, as there is reduction in blood volume due to 15% of blood loss, there will be decreased cardiac output. Decreased cardiac output. As there is decreased cardiac output, what will happen? There will be decreased renal blood flow. Following decreased cardiac output, there will be decreased renal blood flow. As decreased renal blood flow from the juxtaglomeralular complex, there will be release of renin. So from kidney there will be release of renin, and this secreted renin is associated with activation of angiotensin excess. Following activation of renin angiotensin excess, there will be release of aldosterone. Release of aldosterone. And this aldosterone acts upon the renal tubules, and absorption of sodium and water. And as there is absorption of sodium and water from the tubules, there will be correction of blood volume. Patient recovers from shock. Patient recovers from shock without any supplementation from outside like infusion or transfusion. This is the early compensated stage of shock. The patient can compensate the shock and patient can recover from stage of shock without any supplementation from outside like infusion or transfusion. Now come to progressive decompensated stage of shock. Progressive decompensated stage of shock. Mechanism. Again, suppose there is 15% blood loss, there will be hypovolumia, and following hypovolemia, first one is vasoconstriction. Due to decreased volume, there will be decreased cardiac output. Due to decreased cardiac output, there will be decreased renal blood flow. Following decreased renal blood flow, again there is release of renin from juxtaglobulus complex, and this renin is associated with activation of renin angiotensin excess. As there is activation of renin angiotensin excess, there will be a release of aldosterone. This aldosterone acts upon the renal tubule and there is absorption of sodium and water. Sodium and water absorption. Although there is absorption of sodium and water, patient cannot recover from this stage. Patient cannot recover. Patient cannot recover. At this stage, if you give supplementation like infusion or transfusion, then patient can recover from shock. Again, if you don't give any infusion or transfusion, all the mechanism is activated within the body, but patient cannot recover. But if you give supplementation by transfusion or infusion, patient can recover. So, if you give supplementation like infusion or transfusion, then patient recovers. Recovers from shock. Now come to what is the difference between early compensated stage and progressive decompensated stage. In both stages, body tries to compensate. In early compensated stage, compensation is without any supplementation, but in the progressive decompensated stage, if supplementation is given, then there is recovery from shock. This is the difference between early compensated stage and progressive decompensated stage. Now come to irreversible stage of shock. In irreversible stage of shock, there is vasoconstriction, there is activation of renin angiotensin axis, activation of renin angiotensin axis, there is giving of supplementation, either by transfusion or infusion, still then patient will not recover. Still then patient will not recover from shock. and this is known as irreversible stage of shock. Dear audience, I've told you what is the definition of shock. Systemic widespread hyperperfusion of tissue due to disparity between cardiovascular system and blood volume that may threaten life is called shock. I've told you the end stage of shock is hypotension, and in shock there is decreased effective circulating blood volume. I've told you hypovolumic shock, cardiogenic shock, neurogenic shock, anaphylactic shock, septic shock. In hypovolumic shock, shock is due to hypovolumic blood. In cardiogenic shock, is due to disease of heart. Anaphylactic shock, it is IgE mediated hypersensitivity reaction. Neurogenic shock, there is decreased vascular tone that is associated with pooling of blood, and also there is increased vascular permeability. I have told you stages of shock. Early compensated stage of shock. At this stage, patient can recover by himself or herself without any supplementation. But the progressive decompensated stage of shock, patient can recover only when he or she is supplemented by infusion or transfusion. But the irreversible stage of shock, patient cannot recover although patient is supplemented with infusion or transfusion. Good after this, thanks all.